first 28 days of life are crucial to the survival of a child. Babies at this age are vulnerable to the hazards of the environment. According to the World Health Organization (WHO), in 2013, 45% of all under 5 deaths globally occurred during this period, up from 37% in 1990. In Ghana, neonatal deaths account for over 45% of all infant deaths. 32 deaths are recorded for every 1,000 live births. The figure could even be higher considering the fact that many neonatal deaths are not reported for various reasons. The northern region constitutes 29% of the total land area of Ghana. The population in 2014 was estimated at 2,779,833, with a projected growth rate of 4.0%. The population of women in their fertility age is estimated at 653,261. Only 37% of these women deliver under the supervision of skilled personnel. The majority of them deliver under the supervision of traditional birth attendants. Most of these traditional birth attendants do not observe basic hygienic practices during delivery and end up infecting the newborn. In addition to the low level of skilled deliveries, there are inadequate emergency neonatal and obstetric care services. It is therefore not surprising that the leading cause of death among newborn babies are infections, including sepsis and pneumonia. The region also records high levels of stillbirths and preterm babies. These factors have all contributed to the high rate of neonatal deaths in the northern region. An initiative by the Ghana Health Service, supported by UNICEF, is however helping to save more babies from unnecessary deaths. The strategy also aims at reducing neonatal mortality rate to meet the MDG targets of 14 deaths per 1,000 live births. The strategy involves institutional capacity building, training of healthcare personnel, and the provision of special care units for the newborn at strategic locations across the northern region. Through the support of UNICEF, the Japanese government, and the Korean International Cooperation Agency (KOICA), the northern region now boasts of 4 newborn intensive care units (NICU) at Bole, Tamale, Savlugu, and Yendi. The acting Northern Regional Director of the Ghana Health Service, Dr. Jacob Mahama, throws more light on the collaboration with UNICEF.
There was a strategy that was developed by National, and then we're using this strategy. And we had support from UNICEF in the last 3 years from KOICA and then the JICA to UNICEF. And then actually we've done a lot during this time. We've been able to train a lot of our prescribers, that is our clinicians. As much as 41 medical assistants have been trained, and 21 physicians, the medical officers have been trained. And also we train CBA, that's community-based agents in the communities, so that they'll be able to recognize early danger signs of the neonates. The leading cause of the neonatal deaths is usually asphyxia That's a mucus block in the nostrils, and they can breathe and all that. And also where the children are very tiny, they are prone to hypothermia, which actually, the decrease in body temperature that can also predispose them to illnesses. And this is a very simple method that we just call kangaroo mother care, that is carrying the baby in front between the breast, and so that you can watch the baby can have the warmth and also can feed from the breast. So this simple method, deaths are actually coming down. For 2012, for instance, we had 460 deaths. The following year it came to 360, and last year, 2014, that's the annual descent, came to around 207 deaths, neonatal deaths. So it means newborn care is progressing well in this region.
About 300 health personnel, including community health nurses, midwives, and physicians, built their capacities under the project.
My name is Tia Flores, and I'm one of those who has been trained by UNICEF on newborn care. Having received training on newborn care, I have helped in reducing deaths through educating mothers on danger signs and malaria prevention.
My name is Alex David. I'm one of the beneficiaries of the newborn workshop organized by UNICEF. I learned how to conduct home visits. It helps us in a way that we now know when to go for this particular home visit. And if you are going out for the home visit, we know very well that at this visit, these are the particular things the lady needs from you.
We are at the Tamale Central Hospital. The NICU unit is providing enormous service to the newborn. 20-year-old Shetu Muhammad was referred to this unit from Gushegu with her baby seriously asphyxiated. But thanks to the skills of the nurses here, her baby is responding to treatment.
The case was severe asphyxia, sepsis, and with hypoglycemia. And when they came, the baby was in severe respiratory distress. We received the baby assessed and oxygen given immediately. Antibiotics was also started. And then other investigations were done. We took blood sample to lab for NPs and then HB. And results were brought, and then the WBC were very high, indicating that there was infection or the child was having sepsis. And the sepsis here is the cord sepsis. The cord was highly infected. So the cord was dressed up, we cleaned it with spirit and then cotton. And the baby was fine on oxygen. The baby was not able to suck too. There was poor feeding. But later, yesterday, the baby was able to attach, was able to grab the breast and suckle. And then NG22 was passed to give top up and to correct the hypoglycemia. And currently, yesterday baby was fine, getting to the evening time, temperature shot up again. So today, doctor reviewed the baby on broad spectrum antibiotics, that is Zinacef, and we collected and saved. And few hours after that, we realized that the temperature has suddenly come down. But we are still monitoring the baby to see the outcome of the condition.
Bridget Dobreku, a beneficiary of the training program, said the unit is contributing significantly to efforts to reduce newborn deaths in the northern region.
The unit has been able to manage about 80% of the cases here. And we have been able to educate our mothers on the kangaroo mother care, which we are using to manage the premature babies. Also, we have been able to use the resuscitation set that they gave us to survive several babies with severe asphyxia. The challenges are many. Looking at the place is very small. Congestion is number one. So we just split if we could get a better place with space. Sometimes we get as many as 17 babies in this unit. Where do we put them? We'll take some and send the rest to TTH.
Here we offer a lot of services to the newborn from 0 to 55 months. Today we are having a child welfare clinic. We give immunizations, we do physical examinations of the babies and their mothers. We also counsel them on the problems we find and then educate them also on exclusive breastfeeding if they've not passed the age of exclusive breastfeeding. Here we are supposed to conduct deliveries, but we don't have space for the activity, so we don't conduct deliveries. We don't even have room to contain them. Some are on the floor. There are no benches, no chairs. In fact, there's no even room itself to even, so you can see that they are even outside in there.
It came to a time one of the facilities they didn't even have glass to conduct delivery, and how safe would someone to do delivery at the facility without protection.
The Bole district is one of the 11 districts that have benefited from the UNICEF-supported strategy.
With the newborn care program, we needed to also liaise with UNICEF. And so when they were establishing NICU centers, newborn care centers, initially our district wasn't part, but we went and made a case and we were given a center at the hospital. And it is 7 a lot. Our facilities refer newborns with conditions to the Center for Management. We also receive newborns from our sister districts, Sola Calva district, who come along. Some newborns even cross from La Côte d'Ivoire. You know, we are just close with Côte d'Ivoire when you pass here. They also come. And that has helped us a lot to manage the newborn situation. Initially, cases were increasing, but now we are seeing a decline in the number of cases. From January to today, 1st June, we had only one neonatal death. And that is a very good sign for us. Including what the communities and the volunteers report from other health facilities, and that shows that our program is working.
The introduction of the newborn care units at strategic locations in the region is helping to reduce deaths among these vulnerable babies. In spite of these success stories, there are still a lot to be covered. Overcrowding is one of the major challenges facing hospitals across the region, whilst the NICUs are too small. Moreover, there is no provision for mothers to relax whilst their babies are under the care of nurses and doctors. Transportation remains another challenge.
Our biggest challenge is actually, the community health nurses have been trained to go on home visits to follow up on the babies that have been born, and even those who have passed through our NICUs, those who are not well, to find out how they are doing. But we have a challenge with transport. That is, they have to move from house to house, and we don't have transport. We use motorbikes. The motorbikes are not there. What we have a lot of them there, but they're all broken down.
To achieve the MDG target for newborn babies, there is therefore the need to expand the NICU units to cater for more babies. The training of more midwives to augment the current number is also crucial. Once the provision of adequate resting places for mothers should be considered an essential part of the newborn care strategy. Finally, transportation should be improved to ensure that health personnel are able to travel the length and breadth of this vast land to save the lives of more babies. It is too early to understand the full impact of the neonatal health intervention from the Ghana Health Service and its collaborators. But if testimonies coming from health personnel and mothers are anything to go by, it is safe to say that the northern region is just entering a new dawn full of promise, a new beginning for the newborn, with the promise to keep the newborn clean, safe, and alive. This new dawn, however, requires a combination of efforts. All hands must be on deck to ensure this day delivers on its promise of healthy babies, healthy mothers, and happy families. Together, let us stand up for the newborn.